Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Urostomy. Introduction. Diseases and problems of the bladder are common. These can lead to the bladder not working well or even the need to remove the bladder. If the bladder is removed or no longer works properly, a urostomy may be needed. A urostomy is a surgically created opening in the abdomen. It is used to redirect urine output. This allows urine to flow out of the body if the bladder has been removed or is damaged. Other names for a urostomy are urinary diversion or ileal conduit. This program will help you understand what a urostomy is and how to care for it. Anatomy. Kidneys are bean-shaped organs located in the middle to lower back on both sides of the spine. Their main function is to make urine by filtering harmful chemicals, known as toxins, out of the blood. The urine formed in the kidneys flows through tubes called ureters to be stored in the bladder. When the bladder is full, people feel the urge to urinate. The urine empties through the urethra. Causes. The most common bladder problems that lead to a urostomy are bladder cancer, nerve damage, birth defects, long-term bladder inflammation. Bladder cancer affects thousands of people every year. Most are over 70 years old. Nerve damage can cause the bladder to not work properly. It can become underactive and lose its ability to contract and empty urine. It can also become overactive and contract too often. Researchers are not sure exactly what causes chronic bladder inflammation. It may be caused by problems with the lining of the bladder, inflammatory cells, damage to the bladder from urine. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Urostomy. During surgery, an opening is created, usually on the abdomen, to allow the urine to flow out of the body after the bladder is removed. It can be called urinary diversion or ileal conduit. A short piece of the small intestine is removed. The remaining intestine is reconnected so that it works normally. One end of the removed piece of intestine is attached at the skin surface to create a stoma. A stoma or ostomy are terms used for the opening created on the outside of the body. The ureters, which normally carry urine from the kidneys to the bladder, are then attached to the piece of intestine used as a conduit. The urine travels through the newly formed ileal conduit and the stoma into an external collecting pouch. Generally, an ileal conduit stoma is located on the right lower area of your abdomen. The site may or may not be marked before surgery by your surgeon. It may be done by a wound ostomy continence nurse or WOCN. Since a urostomy means that either the bladder has been removed or has been bypassed, there is no voluntary control over when to urinate. Instead, a pouch is worn to collect the urine. Urination after urostomy. After a urostomy, the patient loses control of urination. The urine continuously flows out of the urostomy. At first, the urine may have a slight reddish color to it. The urine should return to its normal color after a few days. With the urostomy, mucus may collect into the pouch. The mucus comes from the segment of intestine that was used to form urostomy. Stoma Care. Stomas vary in size and color. A beefy red color is normal. Some stomas bulge slightly outward, some are flush with the skin, and some are drawn slightly inward. If a stoma is accidentally bumped, It may bleed just a little. This is normal. There are many different types of pouches or appliances that can be used to collect urine. One-piece pouches are applied directly on the skin surrounding the stoma. Two-piece pouches have a wafer that is applied to the skin. The pouch itself then gets snapped onto the wafer. The wafer needs to be changed every 3 to 4 days. Products for pouching. When either kind of pouch is placed, you need to make sure that it fits well, has a barrier of 1/8 inch to 1/4 inch from the stoma, does not allow any urine to leak. Special paste is available that will make a secure seal. When changing pouches, you should clean the surrounding skin with warm water. Soft paper towels can be used to clean the stoma and surrounding skin. Hair on the skin surrounding the stoma can be clipped with scissors or an electric razor. It is best not to use regular safety razors. The urostomy pouch has a spigot at the bottom of the pouch for urine to be emptied. Empty the pouch when the pouch is about 2/3 full. Drainage bags. The bedside drainage bag is connected to the pouch with an adapter that can be snapped onto the end of the pouch by a long tube. It can be hung on a bed or chair, or it can be pinned to clothing. The bedside drainage bag is connected at night before going to bed. When you get into bed, arrange the drainage tubing so it does not kink or loop. To connect the bedside drainage bag: 1. Wash your hands before connecting the drainage bag. 2. Attach the drainage bag to the bed below the level of the bladder. 3. Remove the cap from the drainage bag tubing. 4. Clean the end of the drainage bag tubing with alcohol, being careful not to touch the tube after it is cleaned. 5. Attach an adapter to the end of the pouch spigot. 6. Connect the drainage bag tubing to the adapter on the end of the open spigot on the pouch. 7. Wash your hands. Empty the drainage bag when it is about 2/3 full. To empty the bedside drainage bag, complete the following 10 steps. 1. Wash your hands. 2. Remove the drainage tube from the cover. 3. Unclamp the drainage tube. 4. Drain the urine into a measuring container or directly into the toilet if you do not have to measure the urine. 5. Do not touch the tip of the drainage tube with your hands, toilet, or measuring container. To empty the bedside drainage bag: 6. Clamp the drainage tube. Make sure all the urine is off the end of the drainage tube. Clean the end of the tube with an alcohol pad and put the end back into the cover. 7. Measure the urine if your healthcare provider wants you to keep a record of your output. 8. Empty the container into the toilet and rinse the container with running water. 9. Wash your hands. 10. Write down the amount of urine if you are keeping a log. To disconnect the bedside drainage bag: 1. Wash your hands. 2. Empty the bag. 3. Close the pouch spigot so no urine leaks when you disconnect the bedside bag. A bedside drainage bag can be used for several weeks if cleaned well every day. A leg bag is a small drainage bag that can be worn with a urinary pouch and emptied frequently during the day. A leg bag should not be worn at night. To clean the bedside drainage bag: 1. Wash your hands. 2. Wash the bag with soap and water. Swish soapy water in the bag. Rinse thoroughly with running water. 3. Rinse the bag with a solution of 1 teaspoon of white vinegar added to 2 cups of water. 4. Hang to dry. 5. Put caps on tubing and drainage ports when not in use. 6. Wash your hands. A few weeks after surgery, you can usually go back to doing the things you did before surgery. You can take showers with or without a pouch on. It is important that the skin is dry before a new pouch or wafer is applied. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Diseases and problems of the bladder are common. These can lead to the bladder not working well or even the need to remove the bladder. If the bladder is removed or no longer works properly, a urostomy may be needed. A urostomy is a surgically created opening in the abdomen. It is used to redirect urine output. This allows urine to flow out of the body if the bladder has been removed or is damaged. Other names for a urostomy are urinary diversion or ileal conduit. The most common bladder problems that lead to a urostomy are bladder cancer, nerve damage, birth defects, long-term bladder inflammation. During surgery, an opening is created, usually on the abdomen, to allow the urine to flow out of the body after the bladder is removed. A short piece of the small intestine is removed. The remaining intestine is reconnected so that it works normally. One end of the removed piece of intestine is attached at the skin surface to create a stoma. A stoma or ostomy are terms used for the opening created on the outside of the body. Stomas vary in size and color. A beefy red color is normal. Some stomas bulge slightly outward, some are flush with the skin, and some are drawn slightly inward. Thank you for using Explain.